Welcome to NewYorkBIO's Patient Engagement Summit, an annual event bringing together patients, advocacy groups, and life science and biotechnology leaders. This panel discusses patients and policy. How do we move the needle? Featuring Maya Bermingham from Regeneron, Dr. Gary Puckrein from the National Minority Quality Forum, Christopher Cox from Representative Yvette Clark's office, and patient advocate Jen Roman.
Good afternoon, morning to everyone. Thanks so much for joining us. We are embarking on an incredible panel today by Zoom. Apologies that we're not in person, but we will be looking forward to an incredible dynamic panel to discuss the impact on change and what makes a good advocate, how to use social media to move the needle, and build relationships with elected officials. We are joined today by three incredible panelists. First, I'm going to introduce Dr. Gary Puckrein, who is the founding president and chief executive officer of NMQF, otherwise known as National Minority Quality Forum, which is a nonprofit healthcare research, education, and advocacy organization that is headquartered in Washington, D.C. The mission of NMQF is to reduce patient risk by assuring optimal care for all. This sounds very, I think, scientific, and I'll let Gary explain a lot more of the dynamic work that he does by conducting evidence-based, data-driven initiatives to eliminate premature death and preventable disease. NMQF's vision is an American health service research, delivery, and financing system whose operating principle is to reduce patient risk for amenable morbidity and mortality while improving the quality of life. Dr. Puckrein comes with many different degrees and accolades, and I will let him speak a little bit more about his work and how he came to this. We're also joined by Jen Roman, who I met recently and was so inspired by. Jen is a 27-year-old patient advocate who is living with secondary intracranial hypertension, Behçet's disease, and Parkinson's. What I found incredibly inspiring is Jen was an EMT prior to embarking on her journey as a patient. She brings that experience to her life. I've been inspired by how you've integrated what can sometimes fail all of us and are helping yourself and so many others. We'll hear a little bit about her journey. And I will try not to really start singing your praises even more as we're talking. Christopher Cox, who is now serves as the chief of staff for the esteemed Congresswoman Yvette Clark, who is New York's 9th Congressional District Representative. He also serves as a senior policy advisor with a focus on healthcare and telecommunications. I've known Christopher for a short time, but have been inspired by how he approaches the legislative work that he does with such care and evidence-based knowledge in a way that is not easy, I'm sure, these days with the politics that we all have to navigate. But he has been an incredible advocate for his constituencies and has shown great knowledge. So with that, we're going to move on to a start of our panel. We are going to embark on a number of questions, and I also invite the audience to submit questions so that we can have a integrated dynamic panel that is hopefully answering a lot of the questions and helping folks understand how patients and other stakeholders can engage to do better for patients. Christopher, if you don't mind, I'm going to start with you. Could you share an instance when hearing from a patient or a caregiver has affected your legislative work and how you incorporate those views into the legislative process?
First, Maya, thank you for having me today, and thank NewYorkBIO for bringing us all together for this important conversation to really address patient advocacy. It's crucial to hear from the patients. I really can't stress that enough. A lot of times people oftentimes feel intimidated when they're coming to the Hill to have these conversations about about legislative issues, because, policy and legislation can be a daunting task sometimes, but it's really not. I think that a lot of times on Capitol Hill, we write pieces of legislation and we went to school, to learn our issue areas, but sometimes it's lost on us that these pieces of legislation impact real lives, right? So it's really important for patient advocates to come to the Hill and put a face with the bill text. And I think that's crucial. That's very crucial. I can't really count the numerous times that I've talked to patient advocates about their concerns with a bill, or asking the Congresswoman to really support pieces of legislation. And they'll come into our office and really give us a take on their story and why this will impact them and how this will impact and better their lives or the lives of their children. So hearing those personal stories really shows us that this legislation is doing more than just being passed on the House floor and passed to the Senate. It's really impacting their lives day to day. And they will come in and oftentimes will give us, opportunities to really hear how these issues impact them, but also really understand that sometimes we miss the mark, because we think a policy will be implemented in a certain way, and they have suggestions that we really can take and move forward. And like the title of the panel is, like, move the needle on some of this policy. So hearing those stories are very helpful, no matter what where you're kind of coming at it. If this is your first time being a patient advocate, or you've been a patient advocate for 20 years, we need to hear all of these stories, because everybody's lived experience is helpful in crafting the next pieces of policy here on Capitol Hill.
Thank you. That's great. So Jen, can you talk a little bit about, I mentioned your story about how you became involved as a patient advocate. One, what were some of the stories or advocates who inspired you? And what, from a technical perspective, did you take from some of those folks, if any? I don't want to assume. You may have had to be a self-teacher. So.
Actually, I can answer both of those questions in one shot, because when I first got involved in the rare disease community and when I first started to really get into advocacy, I knew absolutely nothing. I was very much in over my head, very overwhelmed. And basically I met Sandra Mermelstein, who is an advocate with muscular dystrophy, and she is amazing. She works with Cure CMD, and basically we got together for Rare Across America for RDLA, and she inspired me so much, because this is someone who just right off the bat just knew absolutely every single thing to make everything easier. Sandra very much lives by the work smarter, not harder. And when we got together for the RDLA, she showed me how she put together this incredible Google document. So that way, anytime that we sent our paperwork off to our legislators, we had every single personal one-pager, because you don't really know how much time you're going to have in a lot of these meetings. Sometimes you get like 15 to 30 seconds per advocate. So how can you really be sure that you're getting every single person's voice heard? And sometimes maybe people can't show up. So that was one of our best ways to really make sure everyone gets heard. The legislator has every single story. They know who's presenting which bill. And honestly, it really made a big impact. And we heard back from a lot of the legislative aides who had even said, hey, this layout that you guys have, this is great for us. This is the kind of thing that we need so that we can actually track the legislation that is important to you guys and make sure that we're really getting the job done.
Great. Thank you. Thank you. Dr. Puckrein, that brings me to you, and I'm going to build a little bit on what Jen mentioned, which is, how do you leverage some of the work that you do, including, we talked a little bit earlier about how data helps inform and actually gather and can help tell a patient's journey and story and help legislators. Can you speak a little bit about that and how your many years of gathering data has helped inform the legislative process and help patients in their advocacy?
So the National Minority Quality Forum is thanking Mia for that introduction. We've been collecting health data now for about 20 years. We have a database of over 5 billion patient records. We collect data on about 160 million lives a year, covering well over 100,000 different conditions. So I've had a chance to really live in the data, to understand health patterns in the United States. And one of my takeaways was that the real purpose of our healthcare system is to reduce risk, keep people out of the hospital, keep them from disabilities, keep them from emergency rooms, keep them from dying. And that is really the fundamental purpose of our healthcare system. Sometimes it gets confused. People think it's about financial risk, and they spend more time thinking about the money in the system than they actually think about the patients. And so what we try to do is strengthen the patient voice. So they have very important stories to tell, life experiences living with a particular disease. We have the data. We can show at the population level how a disease is impacting the constituents in a member's district. What are their outcomes looking like? Do they have access to appropriate therapies? And indeed, what does all of that cost? And so that helps the member when they go into briefings and to write legislation because they have a data foundation to the story. And so it is a combination of the patient voice with the data. We think that makes a real difference. And that difference really is to reduce risk, to help members understand how through legislation they can improve the life of their constituency and really the health of the American public.
Thank you. Thank you. So Christopher, that brings me back to you on that question. For many people, we know what we know, and we see sort of the congressional arena in a specific way from the outside. Some of us have worked in government, but it's, for those who haven't, can you, I know you have to be sort of more formal about it, but can you explain to folks sort of what your day looks like and how they can be effective advocates? Because you spoke to how important it is to hear from constituents, but are there concrete things that help you because you are meeting with so many people? You have thousands, if not, millions at times of people writing in and calling you. How can people best help so that they can present their case, the data, all of the things that help in the different process, not processes, but sort of the different stages of legislation? I asked you a lot of questions in there, so I apologize, but I'm trying to get to giving people a little bit of more of an idea of how you approach things from that vantage point.
Sure. First off, we have several legislative assistants and legislative aides in our office, right? So those staffers really are responsible for specific issue areas in our office. For our patient advocates, a lot of times they'll be reaching to our legislative assistants and aides first via email or phone call to really set up a meeting. And again, I said this earlier, but no matter if this is your first time being an advocate or you've been doing it for 20 years, you'll interface with a congressional staffer. And just to really set, kind of level set and let the staffer know what exactly you're coming in to advocate for. So we can kind of do our due diligence on our end to really look into the issue and to make sure we're ready for our meeting. It's very exciting here on the Hill. We're opening up slowly. So I'm excited to get some more patient advocates into our office. But once that meeting is kind of established, we'll have those patients come in for a 15-minute meeting or a 30-minute meeting to really plead their case, and kind of let us know what the Congresswoman needs to vote on or what she needs to support, write a letter on, or tweak a policy of hers. So when those when those patient advocates come in, it's great to, like I said earlier, to hear their story, but they also come in with other information that really helps us kind of make a determination. I know Jen mentioned having one-pagers earlier. We have hundreds of meetings throughout the week, right? So it's really great if we can have one piece of paper that we can kind of take back to our desk, with a quick and dirty information on it, so we can know what the issue is, what do we need to solve, how do we need to solve it, and what do you advise the Congresswoman next step to be. So having those one-pagers are very important. And a lot of these patient advocates come in, some can come in just by themselves, but they also can join like an advocacy group or a large organization who will kind of help you with these issues as well. So if you ever feel that you can't be a patient advocate, I want to tell you that it's not true. We need you here, and we want to hear from you. But there are also ways for you to kind of create larger groups that really drive the point home or why we need to move on a legislative item. And they'll give you like all the data you need. It's great working with the National Minority Quality Forum, who has a wealth of information and data that we can kind of look into. And I can really reach out to them and follow up on any of our conversations. So just having those one-pagers is helpful. Directing us to additional websites is helpful. And staying in constant contact. You know, I really encourage all our patient advocates to really stay in contact with us so we can make sure that we're up to speed with the most up-to-date data, and I can keep them up to speed about where a bill is, what the next step of a bill in the bill process, and how can we help, how we can utilize their story to move that forward. If you're talking to our office and Congresswoman Clark's office, if you go to another member's office too, you know, we as congressional staffers communicate with each other too. So we'll love to share your story with other staffers and help facilitate those needs. So that's pretty much what your typical day looks like here on the Hill when you're coming as a patient advocate, and how we can best work with some of the tools you give us to make the best decision for the Congressman and advisor on how to move forward.
Great, thank you, thank you. And Jen, to that point, you shared the story of sort of what inspired you. How has your journey included others, and how have you helped to amplify the voice of some of the other patients? You were one person, you're an incredible person, right? But can you speak a little bit about how, what your journey has been in sort of gathering different perspectives and becoming a patient advocate and a representative who is presenting some of that information and helping folks like Mr. Cox do his job?
Absolutely. I think one of the most important things that you have to remember being a patient advocate is that while it's important to advocate for your case and your cause, you're not the only person in this situation, and we're very much all in this together. And, you know, for me, I've met so many people just from being able to work with the RDLA and work with Patients Rising as an ambassador. And, you know, there was actually one young woman in particular I'd love to tell you about. Her name is Cleo, and I met her through the Hydrocephalus Association. And I worked there basically as a peer mentor. And when she was introduced to me, she was dealing with a lot, very overwhelmed, had just gone through, you know, another brain surgery. And it's very difficult, you know, being a part of the hydrocephalus community, going through constant brain surgeries. And, you know, as a mentor, typically, you know, like we check in and we have conversations, but I saw something incredibly special in this young woman. And I saw someone who truly had a zest for public speaking. And so we really started harnessing that and working on it. And she's just gone on to do so many incredible things. And when you look at these people just like as singular individuals and what they can bring to the table, you know, we need every single patient voice. It doesn't matter if we have the same conditions and if we're, you know, from similar walks of life. Like, every single situation is going to be different because medicine impacts us all in different ways. It's an ever evolving science. And in order to really have a full perspective of what each journey looks like, because no two are the same, you need every single patient voice. And so I think for me, my biggest journey has been trying to connect with as many advocates as I can and really try to empower people and move them forward and, you know, really see what we can make happen in terms of legislation and innovation. Because honestly, if we don't have every single patient voice, we're not going to be getting that innovation as well. We're missing very important data points by not hearing every single person's story. And that's whether we're looking at it from a personal level, if we're looking at it from a scientific level, all these things matter. And so that's been really a big part of it for me.
Great, thank you. And Dr. Puckrein, I was wondering if you could comment on the ways in which the digital and the social media and other media advances, we will call them, have affected your job.
So I must confess, before COVID, I didn't really appreciate the power of social media. And COVID hit the minority population disproportionately. And a couple of members came to us. They were, you know, trying to put together some federally qualified health clinics in their community and some community-based organizations to try to deal with some of the issues that were going on in community. And as we started to talk to those in community, what we realized is that there was a lot of disinformation that was coming into the community, not just domestic, it was international. It was really bad stuff that was coming in, and they did not have the capacity to push back They weren't on social media, and they weren't networked. Part of social media is not just the individual organization, but it's the networking of organizations. So we decided to get engaged and build some platforms and link community-based organizations together so that they could deliver information. I'll give you the precise example was no one knew about these monoclonal antibodies in the minority community. Here were these high levels of hospitalizations and mortality. There were these monoclonals that could really have a benefit. Did not know about them, were not educated about them. Neither the clinicians in the community as well as the individuals in the community. And so we used social media webinars, we call them microsites, put together bits of information to educate. We reached to the federal government and got them in to help educate. And it was a real lesson for us. And it also taught us that we sort of missed the boat with this pandemic. We did not do enough to educate community and get them prepared for the challenges of the pandemic, as well as some of the opportunities to really reduce the hospitalizations in the emergency room, as well as the deaths that occurred. So I've become a real fan of social media. I think it's incredibly important, and it's another tool in the toolbox in how we need to educate the American public and help them make good choices for their health.
Thank you. Mr. Cox, I'm going to ask you a similar question, and I'm going to preface it by saying when I worked on the Hill, I'm going to date myself, but email became a thing as opposed to letter writing, right? Hard copy letter writing turned to email, and we found that incredibly overwhelming. How do you lasso social media? Because I can only imagine what it's like being on the Hill trying to harness all the different inputs that you are getting and trying to distill them into good policy, good interaction with your constituents. What are your biggest challenges, and what are the best things about social media?
First, that makes me smile just to hear the evolution of communication as you reach your representative. I think it's in the best it's in the best interest of us all that we make sure that we are providing multiple outlets for people to kind of reach their members of Congress. But we still receive a lot of handwritten letters. People still like it, the old school way, and we still do receive a lot of emails. But this new emerging like social media front has really changed the game for us. It makes us, it puts us in a situation with a lot of our constituents and a lot of the patient advocates as well to really hear from them in a timely manner, right? You can send off a quick tweet to get your point across. We can make sure that they're sharing like the most up-to-date information on Twitter, on Instagram. So I think that that is the best part about social media we can really receive this information in the instant. And we get a lot of information from people across the country, right? The Congresswoman Clark represents New York's 9th congressional district, which is Brooklyn. However, she does weigh in on a lot of issues that affect everyone across our nation, right? So it's great to hear from other parties who have a stake in the game on pieces of legislation. And that really is a great opportunity for us to kind of broaden that communication, to really get a better sense of what this nation needs when the Congresswoman needs to make a decision. I think one of the most challenging things about social media is that I have to go back to Dr. Puckrein's discussion around disinformation. The Congresswoman has seen this coming for a long time now. When the pandemic hit, we knew that, a lot of our constituents, we have a very diverse constituency of immigrants, Black and brown folks. They weren't going to get the information that they needed on the front end. So, on the good side, social media was a way to get this information out to our communities, but also we have a lot of bad actors out there who are putting out false information that we're consistently trying to fight and correct the narrative. So it was also very helpful for us to really work with organizations like NewYorkBIO to bring together briefings for the public so we can let them know exactly what's going on from trusted professionals. So we can get this information out not only to our constituency, but across the country to make sure that people are educated about some of these issues. So I think that instantaneous communication is very helpful in today's day and age. But we're still receiving other methods of communication through phone calls, emails, and letters. So we are very excited to kind of add social media to the toolbox people use to conduct their membership conference.
Thank you. And Ms. Roman, I'm going to ask you the same question. You probably don't remember what it was like pre, but I'm going to ask you the same question. You know, in your role as a patient advocate, how has that social media and those platforms helped, and what are the challenges and any tips that you have for sort of lassoing down what can be a beast of a platform?
So the funny thing is, that was actually how I even discovered the rare disease community existed. It literally was me playing around on Instagram with hashtags, and all of a sudden, this entire world that I knew nothing about just completely opened up. And I was so surprised that there were so many other people going through the exact same situation as me. And I think one of the craziest things that I've seen is how many, young rare disease advocates have actually become social media influencers as a result. And now for once, kids have representation. They have someone they can look to who looks like them, who's going through the exact same situation as them, and they can actually feel normal. And I feel like that's one of the toughest things that you deal with when you're in the situation, is that thirst to feel normal. And, for me, being able to actually see so many people utilizing their voice in a very creative way. I mean, you have people doing these TikToks and memes, and they're very funny. And being able to actually add a sense of humor to it, and being able to humanize it and really just normalize the entire situation, there's really nothing better. And I think my advice would just really be to actually go on social media. Go on Instagram, actually look at the hashtags, put your disease in hashtags. I promise you'll find like 50,000 other people just like you, and you'll probably also get some laughs out of the funny things that they post.
Great. It's a good way to really approach it.
Gotta have a sense of humor.
Yes. So Dr. Puckrein, I'm going to ask you a question that is a leading question. So you have talked a little bit about data. Can you help for our audience describe one of the accomplishments you're most proud of in terms of some of the data that you've used? What does it represent to you, and how have you seen that accomplishment used in the patient advocacy world and the legislative world?
I would point out some work that we did in COVID. So this was August now of 2020. The virus is roaring through the country. There was predictions out there, if you remember, by February of 2021, about 500,000 Americans were going to die from the virus. And we were looking at the data like everyone else, and what we realized is that the virus is actually a slow-moving train that you could actually predict where the surges were going to occur. And we were struck that no one had put those predictions together and made it available to communities. So we built something called the COVID Index. We were predicting surges 30 days before they occurred. And then we partnered with those community-based organizations and federally qualified health clinics. We asked them for their zip codes of their service area, and we put that on the map. And all of a sudden now they had data that helped them understand what the virus was doing in their community. And later on, we layered on the vaccine information so that they would know whether their population was getting vaccinated. And we thought, well, that's the way you ought to use data in order to help the population. It's like knowing a hurricane is coming, but not warning the population. There was a hurricane in Houston, Texas. I think it was the early part of the 20th century. There was no hurricane warning. Galveston, Texas, actually, where it was, devastated the community, right? Because they had no warning that the hurricane was on its way. That's the same thing we were doing with people with COVID. We didn't give them the information that they could have had that would have helped with the conversation about wear your mask, social distance, because in the immediate moment that this virus is about to surge. And so I walked away feeling very, very good about ourselves. And it turned out to be an intellectual exercise that others picked up on as they learned how we were doing the predictive modeling. So I walked away feeling very good that we had made a real contribution in the middle of that pandemic.
That's great. Thank you. And Mr. Cox, I'm going to ask you another question. You referenced the work that is sometimes done among other staff members from other offices. Can you share a little bit about how that interaction helps in the patient advocacy world? So if a patient comes to you with a concept, you described how you're able to intake, how a patient can provide technical expertise for both from concept, but also can you talk a little bit about implementation passage? How can patient advocates help you, not only by approaching your office, but also other offices to get their goals across the finish line?
Great question. It brings a smile to my face. It's really exciting because I know earlier I referenced just a lot of times patient advocates come to us, mostly because they, the Congresswoman represents them in their district, right? But maybe what the issue that they're bringing to us is best handled by another office. And we kind of can like help them and give them some tips about strategy in other offices that they probably can bring into the fold. Because in order to pass a lot of legislation, once a bill is drafted, we need co-sponsors from other members to join. And hearing those stories helps tell the story why we need these members to join these pieces of legislation. So working with other offices, that's why I'm always open to really connecting patient advocates with other members. I think once a bill's drafted and we're in the process of really gaining co-sponsors so we can bring it to the House floor for a vote, it's great to start telling your story. So you'll see a lot of patient advocates work with members of Congress or work with organizations to create different strategies to really stir the conversation so we can make sure people are talking about these issues. You'll probably see this happen in the sense of like maybe an op-ed in the newspaper that really amplifies the conversation and gives us on the Hill a document to point to and say, hey, Congresswoman, Congressman, these patients are calling for this, and this is the what they've written. So we can kind of see that story in written form as well. And then in the same vein, that's when social media comes into play. You can start creating these hashtags and really encourage, like you can get a really catchy hashtag and really encourage members of Congress. All the members of Congress have a Twitter handle. All the members of Congress have like Instagram. You can really utilize those platforms to say, hey, Congressman X, Y, and Z, please support this bill. And if you do that in a group setting and bring patient advocates together to do that, they'll pay attention. We consistently monitor our social media pages. So they're seeing those hashtags, they're seeing those calls for change. And that's very helpful, again, to get these co-sponsors up. And lastly, I'll say this is, they do also have Hill days where a lot of patient advocates would come to the Hill, have conversations with members and kind of do it as a unit and go from office to office and they set up meetings and have these conversations and also have briefings. So the staffers are very informed on what's going on. As I spoke about earlier, we have congressional staffers called legislative aides and legislative assistants. Having them briefed about what your issue is of the utmost importance so they can really take it back to their members. So those are ways that the patients can really engage and help get a bill from idea to bill passage. And we need you all's help in those conversations. We need to hear your stories. We need the hashtags. We need the op-eds. Any way we can kind of get the word out is great and extremely helpful for us.
That's a great answer. Thank you. Ms. Roman, for someone who wants to get started in advocacy, what advice do you have? You've done it. What's the good, bad, the ugly? What are the best things that you would recommend and what are some things to avoid?
There are two places I can send you right off of the bat. Number one, go to Patients Rising. They are absolutely incredible when it comes to resources and education. There's actually a masterclass that I am currently taking that has introduced me to parts of my medical journey that I never even knew existed. There were so many situations that they really enlightened me to with a lot of the modules that we've covered in our time with the masterclass. And I think it's a lot easier to fight on when you can actually identify who your opponent really is, and then you can actually focus all of that energy to the right place. So absolutely go check out Patients Rising. They're also really, really great when it comes to shouting you out and getting you on Instagram so you can, make those catchy hashtags and, get those bills running. So that's one of the very important places I can send you. I also recommend the RDLA and Every Life. They do Rare Disease Week on Capitol Hill and Rare Across America. And those are really great opportunities for someone who is just starting out because they offer a lot of mentorships. It's very much, they will hold your hand through the situation. They're not just going to throw you to the wolves and say, okay, here you go. Here's your senator, have a conversation. But it's a really great opportunity for anyone who maybe they just got diagnosed. This is their first year really getting involved. And you'll meet a lot of advocates who are either in your situation or, just like I mentioned with Sandra, have been doing this for a long time and can really give you a lot of insight and, are very much a wealth of knowledge. And I think from there, once you kind of do 2 or 3 of those events, you have it, you got it down. And from there, you can really start branching out into doing podcasts and doing panels. And there are so many podcasts that are out currently in the rare disease community that are always looking for people. And that's another great way to get started, because once you kind of get telling your story down and you really start getting comfortable with it, that's when it gets even easier, because then when you go into those legislative meets, you already know what you're going to say. And in terms of being able to, find the legislative asks that are important to you, really start looking on congress.gov, really start tracking through and, seeing what applies to your condition. I didn't realize how many bills were specific to my condition, but there's also obviously legislation that covers many different things. For instance, when you're thinking about the STAT Act, and a lot of the bills that I was introduced to, I found through, like I said, RDLA and Every Life. So that is a great place to really get your feet wet and figure out exactly where you want to be in the advocacy community.
That's incredible. Thank you for sharing that. Dr. Puckrein, and I'm going to actually throw it to the group. How do we think differently about policy that could affect disadvantaged minority populations, rare disease populations? Some of this is what makes it hard is these groups are underrepresented. What are some ways that you can think about demographics in addition to patient outcomes, access, and legislation? And that's a broad question, but I'm just always curious, knowing that you have to influence, right, on something that may affect a few people. How do you actually garner support?
First, full disclosure, I talked about the monoclonals and the COVID index. We had support from Regeneron on both of those. And I want to say that Regeneron really didn't have a dog in that fight because the federal government had purchased all of the monoclonal antibodies. So it wasn't, Regeneron didn't have a fight in it, but they understood that there was something going on in minority communities in terms of access to the monoclonals and what was going on in terms of them not having the information that they needed about the virus. And so both of those programs were really quite helpful. Patient advocacy is part of medicine. I mean, that's the deal right now. If you're not advocating, you're not getting. And so I look at advocacy as a branch of medicine. And so you can't really sit back because so much of our healthcare system, at least the system that I'm aware of in Washington, D.C., they're always talking about financial risk. They're always talking CMMI is going to have a new payment reform or some new payment reform or some new financial model. They've completely lost sight of the patient. And the only way to bring them back is for patients to raise their voice and say, hey, I'm over here. I'm your constituent. Here's what's happening to me. I need your help. And by the way, we've got some data here to show you exactly what's happening in your community. And so it's bringing those two elements together can be the catalytic agent to really bring about change in the legislative process so that it is more focused on patients. Because at the end of the day, that's the purpose of our healthcare system. It's to reduce risk for patients. And it's not about financial matters, it's actually to reduce risk. And so I think patient advocates are the voice that's needed in the system to bring about that sort of change.
Thank you. I know we're on Zoom, so I'm going to prompt Ms. Roman and then Mr. Cox after that.
Yeah, actually, I'm really glad you asked this question because it actually affects me personally. Being diagnosed with Behçet's disease, I belong to a micropopulation of patients. And, we're very often looked over. But I think the thing that we need to keep reminding our legislators, the thing that we need to keep reminding physicians, researchers, anyone, is that you basically, this is the way my mother explained it as a nurse. She likes to explain the body as nothing more than glorified plumbing. So if we think of it as a system like that, if we're looking into one area of medicine, any kind of data, any kind of research, any kind of innovation we find in that field will surely affect the other. So when we take it from that perspective, anything that we find is going to help another disease population. So why wouldn't we help the micropopulations if we know that that same research and that same data is going to influence broader populations? If we can help everyone, why don't we?
Great answer.
And I'd like to add just, a rising tide lifts all boats. And I know Jen kind of alluded to this earlier, but no matter who you are out there, and if you're a patient advocate, if you want to advocate, we need to hear your story. We need this legislation on the Hill to be reflective of the country that we live in. So no matter what part of the population demographic you're from, we need to see you represented on the Hill, because you're not only advocating on your behalf, you're advocating on the behalf of people out there who don't have the opportunity to come to the Hill to have conversations with their representatives. You have a responsibility to make sure that we're drafting legislation that really would positively impact your life. So I just really wanted to kind of double down on that point, that we need to hear your voice all across the demographics of our country. We need to hear your voice in these conversations, because without that, there will be people here like drafting pieces of legislation without you in mind, and we need you to be included.
Thank you. This is great. We have a couple more minutes, and I want to ask a tough question here because it's a little technical, but how do you think about local and state level politics with regard to access as opposed to broad federal? So you've seen it all, right? But how does that impact, and what can patients and their advocates do to acknowledge and navigate those differences?
I love that question, Maya. A lot of times, just kind of let people know how Congress works. The members of Congress spend some time in DC, and they also spend some time in their districts. And I think a lot of times people think they have to come to DC to really advocate on the federal level, which is not true. You can really reach out to your member of Congress's office and figure out when he or she will be in their district office and set some time up with them in your district. That's a great opportunity for you to have some face time with that member, and really engage. On a state and local level, I think a lot of people it's a little bit more touchy-feely, and you kind of see those representatives more often than your federal representatives. But all are important, and you must be heard on all three levels of government. So definitely, you have to reach out to your members, your representatives' offices, and just figure out when you can come in to have those conversations. You don't have to come to DC to advocate on the federal level again. You can stay in your districts and do the same thing and really be impactful. So I just really want to encourage people to take advantage of that.
Great, thank you. Ms. Roman and Dr. Puckrein, I'm going to say Ms. Roman first. I'm sure you've had instances where you've had to do, both local, state, federal. What are sort of some insights you have on that aspect?
I would honestly love to say, I think the most important thing you have to remember as an advocate is that medicine is not a bipartisan, or it is a very much a bipartisan issue. And you can't have any level of partisanship when you're, really trying to advocate and tell your story. And there have been so many instances where the people I thought I would agree with the least ended up being my heroes and have really championed my cause. And, so you always have to be very, very open-minded, I think. And, also trying to keep in mind that every time you tell your story is important, and that you always have to make sure that, when you're talking to your legislators, that you're really, really giving everything you have, and you're really sharing, your heart and soul with them, because you're basically advocating for your life. It is that important. And that's what I would say to that.
Thank you. And Dr. Puckrein, do you want to round us out as we're
Yeah.
approaching? We're 1 minute over, but I want to hear your perspective.
I'll do this quickly. We've had the good fortune to have been able to work at the state level and to do briefings and with state legislators. A tough job, and the system is really set up very badly for them. And I'm thinking here of the Medicaid program. We have 90 million Americans on Medicaid, and each year those books have to be balanced because it's tied to state budgets. And that's when I talk about financial risk, that's one of the places I'm talking about. That we really need to rethink that a little bit because those legislators have a tough job on their hands because they're on one side trying to balance the life of their constituents, on the other side of that they've got to balance the state books, and that's not a good place for them to be. And I think we need to give some real thought to that program.
That is a very provocative answer. I love it. So I want to thank our incredible panelists, our audience who had some really good questions, and New York Bio for hosting this. As I try to always say, we're all patients, and so we all try to remember that. We come at this from different vantage points, and you heard from many of our different panelists today from different perspectives, and I hope it was helpful as we tackle some of these really important policy issues that affect patients. So thank you to everyone, and I wish you good health, and we'll close out today's panel. Thanks again.
Thank you for joining us for New York Bio's Patient Engagement Summit, and to the patients, partners, and sponsors that help make this event possible. Please visit our website at www.newyorkbio.org and follow us on LinkedIn and Twitter for more.